Hi, Vera here again. Today we are going to learn about high blood pressure and 5 surprising facts that you may not know about it. Doctors and medical practitioners refer to high blood pressure as the silent killer. What makes it even worse is that most people don't know very much about high blood pressure. If you have ever had a friend or relative that suffered with a stroke or heart disease, chances are very good that they also had high blood pressure. High blood pressure affects nearly half of the adult population. Yet many people who have the condition don't know they have it. People with uncontrolled high blood pressure are the ones who have the greatest risk for heart disease and stroke. It may seem like I am repeating myself, but I cannot stress the importance of monitoring and managing blood pressure. The illness and death brought on by this disease is so unfortunate because high blood pressure is treatable and preventable. To lower your risk, get your blood pressure checked regularly. And take action to control your blood pressure if it is high. First, let's find out exactly what is high blood pressure. Blood pressure is the measure of the force of blood pushing against your blood vessel walls. Your heart pumps blood into blood vessels, carrying blood throughout your body. High blood pressure is the common layman's term. Medically, it is called hypertension. High blood pressure is dangerous because it makes the heart work harder to pump blood out to the body. Over time, this contributes to hardening of the arteries, to stroke, kidney disease, and to heart failure. What is normal blood pressure? If you have ever seen or heard a blood pressure reading, it's read, for example, as 120/80. The top number is called the systolic, and bottom number is called the diastolic. Your blood pressure will be categorized by your healthcare practitioner as either normal, elevated, stage 1 hypertension, stage 2 hypertension, or a hypertension crisis. Hypertension crisis is a blood pressure higher than 180. In this case, you need to see a doctor right away. Let's get to the 5 surprising facts about high blood pressure. Surprising fact number 1 is that the exact causes of high blood pressure are not known. Several things may place you at a risk for high blood pressure. They are smoking, being overweight or obese, lack of physical activity, too much salt in the diet, too much alcohol consumption, which means more than 1 or 2 drinks per day, stress, older age, genetics, family history of high blood pressure, chronic kidney disease, adrenal and thyroid disorders, and sleep apnea. In 95% of high blood pressure cases, the underlying cause can't be found. This type of high blood pressure is called essential hypertension. Surprising fact number 2. High blood pressure may be linked to dementia. Recent studies reveal that high blood pressure is linked to a higher risk for a loss of cognitive function. Evidence indicates that uncontrolled high blood pressure during the ages of 44 to 66 creates a higher risk for dementia later in life. Surprising fact number 3. Young people can have high blood pressure too. The American Heart Association recommends routine screening starting at age 3. This is somewhat controversial because the American Academy of Physicians states that there is not enough evidence for or against regular screening for high blood pressure in children and teens. Nevertheless, it is a fact that nearly 1 in 4 adults aged 20 to 44 have high blood pressure. High blood pressure is a leading cause of stroke, and this condition is on the rise among younger people. Experts think the increased risk for stroke in young people is a direct result of the rising rates of obesity, high blood pressure, and type 2 diabetes, all of which are conditions that are preventable and treatable. Please don't make the mistake of thinking that because you are young, you have a long time before you get high blood pressure. Many of the people with high blood pressure, who don't know it, are young people in their 20s and 30s. The only way to know is to check your blood pressure regularly. Surprising fact number 4. High blood pressure usually doesn't have any symptoms. You may have heard a friend or relative complain about not feeling well, and they may have mentioned their high blood pressure as a reason. Actually, they are feeling bad for other health reasons. High blood pressure is called the silent killer because most people with high blood pressure don't have any symptoms. Because many people feel fine, they don't feel a need to get their blood pressure checked. Fortunately, doctors and healthcare practitioners can screen for people who are most likely to be at risk for high blood pressure. Are you in one of those groups? Hopefully, we will find out before the end of the video. To be sure, talk to your doctor about your risk for high blood pressure. Surprising fact number 5. Many people who have high blood pressure don't know it. Nearly 1/3 of adults with high blood pressure aren't aware that they have it, and they are not being treated to control their blood pressure. Anytime you get the opportunity to have your blood pressure checked, ask your healthcare team what your blood pressure numbers mean. If your doctor feels the need to treat you for high blood pressure, stick to your treatment plan. And follow your doctor's advice if you are diagnosed with high blood pressure. In conclusion, by living a healthy lifestyle, you can improve your chances of keeping your blood pressure in a healthy range. This will significantly lower your risk for heart disease and stroke. A healthy lifestyle includes eating a healthy diet, maintaining a healthy weight, getting enough physical activity, not smoking, limiting alcohol use. Ask your doctor or care team how often you should check your blood pressure. You can get your blood pressure checked at a doctor's office or pharmacy. You can check it at home if you have a home blood pressure monitor. Never miss an opportunity to have your blood pressure measured. Be on the lookout for community health fairs or local events by the Heart Association. Be on alert for our upcoming videos where we will help you learn more about steps you can take to prevent or reduce high blood pressure. Thank you for watching this video to the end. If these videos are helpful to you, please support our channel by subscribing and clicking on the notification bell.